Third MBBS first term. In the series of non-communicable diseases, up till now we have seen the introduction and ischemic heart disease. Today, hypertension. Now, this of hypertension will be discussed in the instructional objectives. First is definition, second is criteria, rule of halves, tracking of blood pressure, ideally blood pressure, factors responsible for hypertension, then modifiable and metabolic risk factors responsible for hypertension, then investigations to be carried out for final diagnosis, prevention, primary, secondary and tertiary, and control of hypertension by 5 levels of intervention. These are steps, these are the headings under which we will topic. Now in the definition of hypertension, it is a cardiovascular in 1 billion people all over the world. It is in blood vessels have persistently raised pressure. About 20 to 30% of all the George Pickering formulated of population and said that there is no between direct relation between the risk of blood pressure like stroke and coronary. That means you have some coronary problems, many of them they have hypertension. The intervention controlled hypertension of above 18 years who are there in the study. So this study was carried out in hypertension. Those who are taking anti drugs included, and the of drugs help in controlling the hypertension and classification hypertension. On the other hand, systemic arterial hypertension is defined as of elevated arterial blood pressure as epidemiological, clinical and public health needs. Preventive measures suggested are, they have classified in different. One is pre-hypertensive. Pre-hypertensive person systolic between 139 and diastolic pressure is between 9. For lifestyle modification and public education, essential control. First stage hypertension in systolic blood pressure is between 140 to 159, diastolic between 90 to 99 millimeters of mercury. Second stage blood 160 to 179 and diastolic blood 100 millimeters. In third stage, systolic blood pressure or blood pressure is equal to or more than 10 days. This third stage of is not to 1 and stage 2 is the new methodology. INS 8 has laid down the population level goal management for persons who up to the age of 60 years who diabetes, chronic kidney disease, their control should be range of pressure. Then one diastolic blood pressure should be up to 90 millimeters. persons who are above the age of 60 years but no history of diabetes, chronic kidney disorder, it should be controlled at pressure 150, lecture as 90 millimeters of mercury. Categorization of hypertension is as follows. Categories are optimum, high normal, grade 1, grade 2 and grade 3. In this, what should be the systolic and what should be the diastolic? In blood pressure, systolic should be less than 120 and diastolic should be less than millimeter. Normal blood pressure should be systolic 120 to 129 and diastolic should be in 130 to 139 systolic and diastolic blood pressure 85 to millimeter. 1 hypertension, systolic should be between 140 to 159, diastolic 90 to 99. In grade 2, systolic should be 60 to 100 or diastolic should be between 100 to 109. And in grade 3, 180 millimeters of mercury and diastolic should be more than 110 mercury. This grade 3 hypertension is not considered magnitude of problem, as I have to. Worldwide there are about who are having the problem of hypertension. The estimated number of Indian hypertension 120 millimeter 120 million. There is one hypertension. Clearly that by the year 2025 the number may increase up to 2,000. Among the persons aged 18 years and above, 20% with equal disease and in females. So above the age of 18 years, they have the problem of hypertension. It is more of males and females. The prevalence is more because of their high height is also high, and that is why body mass is so prone hypertension. Then it is also more common in Jain community. In Jain, the tip does not contain onion. All three in the year. That and garlic contain some chemicals which are prone pressure. They are more prone to have hypertension. And you know about that, what is the reason about? Now, isolated systolic is one more isolated hyper where systolic blood pressure is equal to more than 40 millimeters of mercury and diabetes is normal, then he is that person is called isolated systolic patient. Now, one more one should remember, if systolic and diastolic hypertension, that is maybe systolic issue, but in that case take the higher reading that person has hypertensive person, on which the effect of hypertension or of arterial occurs are: number 1 is kidney and is heart, third is retina, fourth is, fifth is stomach. These are the different organs on which the of attention. These. Now, most important thing is this is a major it by a person who should be trained, the instrument marketed, and that should be used in data. An observer who is observing the readings, person should be trained so that exactly taking when to call this is a systolic, when to call this is a diastolic, to make comfortable. That is one more important point. Errors. What should be done is to avoid the instrument, check the time results. Next is about observer error. Training of give. Then number 3 is to avoid individual training will be of help, and subject error by counseling up to have any fear or anxiety or actually psychological effect on his. So, if certain reading, no process exactly about that. WHO has patients. One is sitting position is very position. The blood is uniform policy to take. Then sit quietly for 5 and then pressure. Use a right or left hand to check the blood pressure. Should be left hand and start raising the pressure. First, and then check the readings. The pressure at which third systolic blood pressure, and the pressure release the sound gets muffled is diastolic is in 3 minutes, and lowest. This is one suggestion is according to suggestion to find out the average of the two, that final reading. But if the difference between the two readings, diastolic blood pressure readings, is more than 5 millimeters, in that third should be taken, and then which is the correct one. Now classification of hypertension, primary and secondary. Primary hypertension, which is also called hypertension, is the condition in which the cause is why a patient is unknown. That is called primary. Of the hypertension is of this type. Hypertension associated with other disease, because of which person gets hypertension in 10% of the cases. Can be chronic glomerulonephritis, pyelonephritis, glandular endocrine glandular tumors like say adrenal disorders like hyperthyroidism, Cushing's syndrome, and sleep disorder. Of toxemia of pregnancy are different. Condition can be secondary hypertension. Arterial is free worldwide. Rule of hypertension. What is it meant by? Rule of half says hypertension, half of knowledge to the community. Half of the population is hypertension. Half of them, they are diagnosed. Go to the check their, they come hypertensives. Undiagnosed hypertensives are to take treatment. About that awareness is there only. Most and diagnosed and treated are half. Now out of those who, or is it adequate about that? treated, adequately treated are half. This is just seen level. Prevalence is 80% in India, while global prevalence is 4. In percentage of hypertension is around all over the world. In 60 years, 60 years, increase in body common factors are the responsible. Disability life, disability adjusted life years. Colic blood on 140 in 40% of the cases is due to ischemic hypertension, stroke, and either or these are the two types of strokes or disease causes of prerequisite hypertension. As 4